In April, amid the coronavirus pandemic, with much fanfare, the Cuban medical brigade landed at our Tambo International Airport. The deployment is part of an historic agreement signed between the two countries at the dawn of democracy. It was meant to help provide health care inspired by the Cuban model.
We came a long way together. We fought together for the freedom in South Africa, and we are fighting together to defeat this disease.
We thank each and every one of the Cuban health professionals who are part of this team for their personal commitment and sacrifice.
Know that you are very well prepared to face any difficulty. We know that you will raise very high the name of Cuba.
While some support this project, others have questioned the state's decision to commit millions to it at a time of economic austerity.
Is 240 million rand the most prudent use of very, very, very limited public funds? And what is to be made of the South African doctors who have not been considered?
They are not qualified to practice where they studied, and that's why they're having challenges.
In court cases, where some Cuban doctors have terminated their agreement with the government to work independently, they've been made stateless.
You end up being a doctor without a country.
Former members of the Cuban Medical Brigade have accused the Cuban government of blacklisting them as traitors and ill-treating them because they opted out of the agreement. With the rise in South Africa's coronavirus infection and death rates, can the new recruits make an impact on our challenged health system? "58-year-old Dr. Victor Figueroa was sent to South Africa at the dawn of democracy. He agreed to speak to us after our repeated requests to interview the new recruits were met with silence. Media access to the recruits is restricted, evidenced by their refusal to allow us permission to film the induction process at Sedibeng in the Vaal.
Why is so much always interest in derailing the beauty of the program to land in the materialist-orientated issue of how doctors are remunerated? I wish I would not be paid, but I cannot afford it because the aggressive capitalist society would prevent me from surviving.
Dr. Figueroa is a pioneer of the Cuban approach to medicine in South Africa. He witnessed the signing of the country-to-country doctor deployment agreement.
The founding fathers of this cooperation in health were Nelson Mandela and Fidel Castro as head of states that shook hands and decided that this cooperation was going to be possible. But I'm the pioneer. Today is the Health Professions Council of South Africa to work out how would the future cooperation between Cuba and South Africa take shape.
At the time, South Africa was starting to roll out plans for universal health care, inspired by the Cuban model. 26 years later, it remains a distant dream. With COVID-19, the inequalities have become more pervasive.
Our capacity is grossly unequal. We have more resources for less than 20% of the population in the private sector. And we have less resources for greater than 80% of the population in the public sector. And therein lies the answer. And that is something that the new dispensation has not been able to do anything with. In many respects, it could be said that even though we've ushered in independence in '94 and apartheid was officially dismantled in many aspects of our life, in health, apartheid was not dismantled.
The Cuban approach to medicine is preventative rather than curative. Dr. Figueroa says it's ideally suited to contain diseases like the coronavirus.
Doctors are trained into house-to-house screening, control of the hotspot and the clusters of diseases in the community, and doing the surveillance mechanisms or putting in place surveillance mechanisms that allow the hotspots to cool down, for example. For example, the lockdown system in Cuba is not blanketed across the country. It's selective lockdown. So you detect areas and you cordon and lock down a particular cell, maybe few blocks.
Unlike other internationally trained doctors, Cuban doctors employed by the government under the country-to-country agreement get special privileges.
So there is protections, and this agreement is an official government-to-government agreement that provides certain level of trust into the individual. So they don't have to go to the HPCSA to write a full exam for registration. They will be assessed by an HPCSA member back there in Havana for their basic competences. They're not selected so rigorously as the independent candidate.
But not all Cuban doctors have found the agreement plain sailing. Some approached the courts, citing human rights violations by the Cuban embassy. Their passports were cancelled when they opted out of the agreement. The embassy and the HPCSA were found liable. Currently, 10 cases of human rights abuses are being prepared on behalf of the doctors. The matter is likely to end up in the Constitutional Court.
Will end up being a doctor without a country. They will then have to apply for South African. They normally get permanent residency, but I mean, as you know, it's a long process to get permanent residency and to eventually become a citizen. And that problem is that these doctors then slip through the cracks when it comes to the medical licensing with the Health Professions Council. So there's this ongoing fight, and I don't know if you've seen the judgments from the Labour Court, where the Labour Court has come down quite hard on them, saying, like, why are you discriminating against these doctors in this way? It's not acceptable.
In terms of the agreement, Cuban doctors are restricted to work in government hospitals where they've been deployed.
Once vetted, you would then be registered with the HPCSA and be given the limited registration of registration in public service. You'd also be confined to where you are being appointed by the state. You can't do private work, you can't gallivant and work in other hospitals. You're on a government contract and you will go where that contract places you.
The Cuban embassy did not respond to requests for an interview. Dr. Figueroa says it's morally and ideologically wrong to opt out of the agreement.
Morally, I would never think of that. I have to be proud of being part of this agreement. When you become, as a resident, as a person from the third world, when you become the depository of so many skills given by the society, the least you can do is to contribute to furthering of those ideals and to those ways of helping other human beings.
None of the dissident doctors were willing to speak out. Their lawyer says they fear retribution by the Cuban government.
Nothing could have prepared us. No one thought what was happening could be true. We didn't realize how much we'd miss each other. Everyone said nothing will be the same, but nothing feels the same either. You're stronger than you know. You've changed. We all have. Your time is now, and together we will get through this.
Make your future count. Leave a legacy. Start today. Demlin Online.
trenches of business, it's easy to lose sight of what matters. It's easy to get panicked by bottom lines in tough times, to get bogged down by payroll and cash flow, to worry about what's happening across the border rather than planning to grow past it. In the trenches of business, it's easy to lose sight of what matters. So partner with the bank that helps you see the bigger picture, the bank with the expertise to help your business grow. To guide your growth, search Nedbank Bigger Picture Business Banking.
With the country's high COVID-19 infection rate, health conditions in prisons are under the spotlight.
As a result of the overcrowding, these inmates are prone to get infected.
We actually have been able to contain the pandemic quite well in these facilities.
We're sitting with a huge problem, and every day these people are dying. It's a grave humiliation to the human rights of the inmates.
Parole is a privilege. These are people who have committed murder, rape, very serious crimes in our communities. And ideally, you don't want such people being let out willy-nilly without a very due process.
The Yusuf Dado Hospital in Krugersdorp on the West Rand has prepared COVID-19 isolation and quarantine wards. In cases where patients require oxygen and intensive care, they are referred to bigger hospitals. Dr. Stephen Pia was trained in Havana under the country-to-country agreement with the Cuban government.
When I left here, I had no idea where Cuba was, what kind of country Cuba is. So when we arrived there, one, there was cultural shock. Two, there was a language problem. When we arrive in Cuba, we find that it's an island. It's very hot, temperatures are very hot. Number two, they speak Spanish. I had never had an experience with a person speaking Spanish. I didn't know how Spanish sounds like. But also, Cuba is a socialist country. The political system is totally different from ours.
Dr. Pierce says in his first year, he was taught Spanish and socialist ideology. He says Cuba's approach to medicine has limitations when applied in South Africa.
The preventative model of Cuba in South Africa will, to a certain extent, have challenges. One, because we do not have as many resources as Cuba has. Cuba have enough clinics. Now, in South Africa, we still have a challenge. The number of our primary health care clinics is very limited as compared. The ratio is totally worlds apart. The number of health personnel, doctors and nurses, we still don't have enough.
Cuban doctors deployed under the agreement in South Africa receive government accommodation and a stipend. 50% of their salary goes to the Cuban government.
I'm gladly contributing with a percentage of my salary to the Cuban Department of Health. It's not the government. The money that is remitted from my cooperation here is not going to buy boots for soldiers or pencils for school. It's to alleviate the hard currency budget of the Department of Health.
Some accuse Cuba of using this program for profit, but the South African government says assistance to combat the pandemic comes from a number of countries.
We've received a couple of donations from different companies. Mainly the donations were in relation to the personal protective equipment, your PPE, and we've also received some equipment from
the United States of America, which it's ventilators that we actually put in place at Bara, and we are still expecting more of those donations with other countries, from Europe. These are all in donations, but remember, with Cuba, we have to cover the cost of their travel and the cost of their stay in the country.
Despite its history and the apparent positive impact that the bilateral agreement is said to have on the South African healthcare system, it remains controversial.
What we have been saying as the Democratic Alliance is that is 240 million rand the most prudent use of very, very, very limited public funds? And what is to be made of the South African doctors who are in this country, who are desiring to be on the forefront of the fight of this virus, who have not been considered? We know that the Department of Health has not had an engagement with the professional bodies in the country to find out exactly which experts are available to assist, which experts have not been utilized, and where the gaps are.
Besides the costs, a group of internationally trained South African medical graduates blames the government for being unemployed. Unlike what is required of them from the HPCSA, the Cuban doctors don't need to write an entry board exam to practice medicine.
We have over 300 fully qualified doctors sitting at home and remaining unemployed to the bureaucratic red tape, while the healthcare system buckles under pressure to lack of staffing to the point where foreign doctors had to be flown in from Cuba. With all due respect to the Cuban doctors, I wonder if they had to await approval from the HPCSA too. What was the selection criteria used for these doctors? Would South Africa not have saved millions if they used their very own first before they sought help elsewhere?
They are not qualified to practice where they studied, and that's why they're having challenges. Some of them, it looks like they did medical education for export. That does not work inside the country that they come from. The major reasons they are delayed and they are unable to register in South Africa is that they are not registered as practicing doctors where they studied. Now just understand that our duty is to protect the public. And we've got to be extremely careful with people that are not even credentialed to work as doctors where they trained before we license them in this country. A foreign qualified doctor, in terms of our laws, is a person that is qualified and entitled and credentialed to practice elsewhere, which we call a qualification not prescribed.
Critics question the costs associated with the deployment, money they believe should be used to recruit unemployed doctors, and with no end in sight of the COVID-19 outbreak, the costs could rise, with the likely need for the mission to be extended.
How much is the province paying the Cuban doctors?
It is a national priority or a national duty or an obligation to pay and do all the necessary arrangements. We are only coming in at the level where we are using them. As we are talking now, they are already on the field, they are already doing some work for us. So it's a National Defense Force and the National Department of Health that is actually handling the issues that are leading to the cost.
The Cuban Medical Brigade's global deployments have long been a source of pride and income for Havana, which until recently was subjected to US sanctions for 6 decades.
It swept through our lives and everything changed. We felt such a sense of loss. But with them, we feel hope. We honor the people that shine light again, the people that keep us safe, the people that take care of our children. They will do what they have always done, protect and serve on the front lines. Many of them have come through our doors. We are proud of each and every one. Lyceum, heroes of tomorrow.
On Trends Travel, we are all about levels, starting up with level 5.
And the whole world went inside and shut their doors. And no one act by people as a whole has felt more like love than this.
This has become our lives. Gloves, masks and hand sanitizers. But it doesn't mean your mask has to be boring.
The Fashion Forward Level 4.
Winter 2021. We're going to be chatting to David Lally to find out more about his latest collection. Darling.
The Out and About Level 3. Whether it's hiking, a self-drive.
This one is one of the tamed giraffes. It actually likes people. We miss it too.
Or just cycling.
That's it. It's a wrap.
You will get it right here on your home of adventure.
In our previous program, we accompanied community health workers on the front line of COVID-19 on their door-to-door campaign in Sedibeng. At the time, the community viewed them with suspicion and fear, which hampered their work.
People are no longer allowing us to go in their homes because they say we are coming here to infect them with the coronavirus. Especially when they see us as a community health worker wearing uniforms, like wearing masks. They just think we are coming with, they have this misinterception that we are coming with the virus.
It's in communities like these where the Cuban Medical Brigade has been deployed. They will have to deal with a disease that's been highly stigmatized. In addition, their biggest challenge is the language barrier.
They've been trained on basic English in terms of medical terms. And one thing that is there, that they always have some translator around them who can be able to translate some of the few things that will be required. But they are working with teams that also have got some South Africans to give a bit of interpretation.
Amidst the criticism, Dr. Figueroa pleads for support to allow them to make a difference.
It may have a good impact, and we hope so. In my opinion, they may be very, very useful if they are giving a team of other professionals who have never worked in the community setting, house to house, in an epidemic. The Cuban doctors have done it. Okay? Most of them have even contributed to cool down epidemics in South America of many other diseases, because they do have international experience, and they are not saying they're going to leave.
We joined Dr. Stephen Pia on his ward rounds. He says, coming from a different medical training in Cuba, the South African reality presents huge challenges.
Now you come to South Africa, which is more of interventionist kind of. It means the disease is already at the end, and then you are intervening. So you are diagnosing and treating. So that in itself, and also because of the preventative training in Cuba, you do not get a chance to see a lot of severe condition of illness.
Like HIV,
TB, trauma. So, and those are the things that when you arrive back in South Africa, you'll find that there is a burden of HIV, TB, trauma, car accidents, gunshots, and all that.
He says when he returned to South Africa after 5 years of medical training in Cuba, he had a lot of adjusting to do.
So you spend a whole lot of time training in Spanish. So your brain is programmed to think in Spanish. Terminology, medical terminology also changes when you come back. And that is where, during that last year of training in South African University, a lot of us encountered problems. A lot of us Cuban trained students, through that year, we encounter problems because we are trained differently. We are taught differently.
Meanwhile, the Gauteng Health MEC insists that the Cuban approach is suitable to combat the coronavirus pandemic and cost-effective in the long run.
We want that type of an approach because much of the work that needs to be done in terms of interrupting the spread of the infection is more on the community work and the social mobilization, which is something that they are bringing into our teams that are doing that type of work. And it's something that as a country going forward, it's a type of healthcare system that we want, which will focus mainly on preventative than the curative aspect. The curative aspect usually becomes a bit expensive to run.
Ironically, it's thanks to COVID-19 that some plans to prepare public hospitals for the National Health Insurance Plan have been sped up. The NHI is the government's program aimed at providing universal health care in the country.
One of the things about the National Health Insurance that we are talking about is just to re-engineer our healthcare system to be more on a preventative mode than being on a curative mode. So we are going to learn a whole lot actually from the Cubans in this regard.
Some argue that the lack of transformation, corruption and maladministration have crippled the public healthcare sector. It's delayed South Africa's realization of access to an equal healthcare system similar to the Cuban model.
We cannot sit in a country where those that sit in parliament are on medical aid, where those that sit on the benches of the judiciary, those that sit on the benches of the constitutional court have medical aid. Me and you have medical aid. And 80% of the population is locked up. That's what apartheid was about. But its modus operandi was the pigmentation of your skin. Its effects were profound. The modus operandi now is the size of your wallet. The effects are the same. It's discriminatory. It is basically a crime against humanity.
Cuban medical brigades have not only been deployed to South Africa, but also to other countries, including hard-hit Italy, where despite a better resourced health system, the country could not withstand the devastating effects of the virus. In South Africa, with the health system close to its knees, it's uncertain whether their impact will be long-lasting in the fight against the coronavirus.